Welcome to the First Aid Show Daily Minute Podcast, your daily dose of first aid brought to you by Australia's first and only first aid conference and exhibition, the First Aid Show.
For this episode, we're turning down the background music. So turn up your volume because today we're listening to the lungs. Now, although this is a first aid podcast, we also cater to our first responders and healthcare professionals. Some of the sounds we're about to discuss may only be heard with a stethoscope. Others may be loud enough to hear without one. And as we work through the sounds, think of them in this order: noisy airway, noisy lungs, wet lungs, secretions, pleural disease, or no air movement, because that's often how respiratory problems present in real life. Let's start at the top of the airway and work our way down. First of all, stridor. Stridor is a high-pitched sound heard on inhalation. It often sounds like a harsh squeak or wheeze coming from the throat rather than the chest. Stridor is caused by an upper airway obstruction. So think croup, epiglottitis, foreign body airway obstruction, choking, or severe anaphylaxis. This is one of the sounds that may be heard without a stethoscope and can often be heard across the room in severe cases. And this is what stridor sounds like. Wheeze. Wheeze is a musical whistling sound caused by narrowing of the lower airways. So think asthma, bronchospasm, COPD, or anaphylaxis. Mild wheezing may require a stethoscope. Moderate to severe wheezing can often be heard by the first aider without one. And this is what wheezing sounds like. Bronchial breath sounds. Bronchial breath sounds are normally heard over the trachea and major airways. They sound louder and harsher than normal lung sounds. If heard elsewhere in the lungs, they may indicate consolidation, such as pneumonia. These sounds generally require a stethoscope to appreciate properly. And this is what bronchial breath sounds sound like. Fine crackles. Fine crackles are tiny popping sounds heard during inhalation, and many people compare them to hair being rubbed through your fingers beside your ear. So think pulmonary edema, heart failure, pneumonia, or interstitial lung disease. They usually require a stethoscope, and this is what fine crackles sound like. Coarse crackles. Coarse crackles are louder and wetter, and they sound like air bubbles going through fluid. So think pneumonia, pulmonary edema, ARDS, or heart failure. Severe coarse crackles may sometimes be audible without a stethoscope, and this is what coarse crackles sound like. Rhonchi, also known by other names such as Sonorous wheezes, are low-pitched rumbling sounds. Many people describe these sounds as snoring, and they're caused by mucus and secretions in larger airways. So think bronchitis, COPD, or excess airway secretions. Rhonchi often improves after coughing. Severe rhonchi may sometimes be heard without a stethoscope, and this is what rhonchi sounds like. Pleural Friction Rub. Normally the pleural surfaces slide smoothly against one another. When inflamed, they rub together. This creates a harsh, grating sound, often described as walking on fresh snow. Think pleuritis or pleural inflammation. This is generally a stethoscope finding, and this is what pleural friction rub sounds like. Absent breath sounds. Sometimes the most important lung sound is no lung sound at all. Absent breathing sounds occur when little or no air movement is heard in part or all of the lungs. Think pneumothorax, hemothorax, severe airway obstruction, or significant chest trauma. And this is what absent breath sounds sound like. Silence. Sometimes hearing nothing is the most important finding of all. And finally, silent chest. A silent chest is different from absent breath sounds on one side. A silent chest occurs when airflow becomes so restricted that very little air is moving anywhere. So think severe anaphylaxis or severe asthma. The patient may appear exhausted and struggling to breathe, yet you hear almost nothing. And this is what a silent chest sounds like. Near silence. Remember, sometimes the sickest respiratory patient isn't the one making the most noise. It's the one who has stopped making noise altogether. When air can no longer move, neither can oxygen. So let's recap what we've learnt today. A big episode. Airway sounds, Stridor, airway narrowing, Wheeze, air movement through lung tissue, bronchial breath sounds, fluid in the lungs, fine and coarse crackles, secretions in the larger airway, Rhonchi, pleural pathology, pleural friction rub, no airflow at all, absent breath sounds and silent chest. Now, you don't need to diagnose lung sounds as a first aider, but recognising abnormal breathing and knowing when the patient is becoming critically unwell may help you get assistance sooner from ambulance, because sometimes the lungs tell the story way before the patient can. And always remember, do what you've been trained to do and always act within your scope of practice.
Thanks for tuning in to the First Aid Show Daily Minute podcast. Don't forget to like, subscribe, leave a review, and follow us on social media for more first aid tips and updates. Until tomorrow, stay ready, stay confident, because a prepared first aider saves lives.